Uh, Hello, everyone. Welcome to the latest episode of the Healthcare Innovation Podcast. Today, we have a special guest with us, Dr. Varun Gupta. He's one of the most knowledgeable persons in the healthcare sector that I have met in last few years. Currently, he's the Senior Vice President at 1MG. He has been on the forefront of this COVID fight in last 15 months, working on solving various challenges from the times when we had lockdown to the first wave to the second wave, seen different set of challenges and been at the forefront of dealing with it, whether it is diagnostics, whether it is treatment, whether it is advising government on the policy front. So today we would like to invite Dr. Varun and learn from him around his experience on this COVID fight. But before we go there, maybe Dr. Varun, if we can start with your introduction, little bit of your background, and then dive into COVID as a subject.
Thank you, Dr. Puram, for giving me an opportunity to speak on this topic. It's a pleasure to be part of this particular conversation. So just a brief background, I've done my MBBS, MD, and I'm in part of the health technology space for almost 10, 12 years now, looking at education, health education space with Elsevier. Before this, 6 years in Elsevier, I was heading the content strategy for South Asia for Elsevier. Then incidentally that health tech for consumers was coming up at that point. Incidentally that health card plus at that point 1mg just happened to me from my own use case, which I thought is a very, very powerful tool, very powerful way to help people solve their problems. So that's where I switched from a multinational company to a startup operating in a health tech space. And I've been part of the 1mg journey for now almost 7 years, 6.5, 7 years. I have worn multiple hats at different parts of the journey. That's broadly about my background. Looking at the clinical side of the things, clinical operations, clinical technology, clinical legal policy, regulatory, all those interfaces where we can bring value on the table. That's what we have been kind of trying to do. And specifically, when on the COVID front, I'll come to that COVID front. So 1mg as a platform is an integrated healthcare platform. So to our journey, we started as an information platform. Incidentally, we just launched a drug mobile app with drug information and we got so many downloads. So information remains one of the core pillars of 1mg, that how do we address the information asymmetry in this space. And specifically when this COVID pandemic started, there was so much of information that was flowing in, and how do we make it consumable for the consumers yet accurate, to the point, referenced. That's what is one of our core strengths, right? So we started creating a lot of authentic, simple to understand content for users on COVID, and we got I mean, with God's grace, it was a well-received content all over. There were multiple ebooks which we launched. That the popular No Panic Guide was translated in multiple languages, circulated across the countries, and then we created a lot of videos. We take a lot of pride to say that finance minister retweeted one of our videos at some point. So gives the idea was to just sit down with a lot of research studies, identify that which are the most authentic studies out of it, add a clinical and consumer layer of over the top of it, create good, simple to understand graphics, and that was the whole idea. And continuously, as that it was emerging, we partnered with the right experts from All India Institute Medical Sciences, Medanta, and so forth. All the people who are experts on this field, work with them to make the content, make the information piece very, very simple to understand yet accurate. That's what one of the pieces. And as I said, one of the videos we got almost 20 million downloads, 20 million views in no time.
Wow.
So this is a huge, I would say the numbers were huge in terms of the content piece. So that's one very strong pillar we had on information. And we are continuously, right now also we are doing that piece, partnering with, for example, if we are talking about vaccine, we would go out for to talk to the chief investigator, principal investigator of the trial. to just get insights what is actually going on that front, and also make it more consumable. So that's just on the information piece. And the sorry for this. Second is, as 1MG, as I said, integrated health platform. Second piece is, of course, the pharmacy marketplace, where we work with pharmacies all across the country to make sure that people get access to essential medicines, get access to all the essential supplies. So our entire frontline staff was trained on the COVID protocols, safety protocols, and they worked 24/7, taking the risk across the country to make sure that the medicines were delivered. Because, of course, at that point, uh, we got a lot of demands, 5x demand from our current scale. So all of us had to step up to our capability in terms of technology, in terms of operations, in terms of manpower, everything. And I do remember a point that uh, the first lockdown in April 2020, we got this notification that pharmacy is an essential service. But getting a policy from a center, working with 700 districts across the country, making sure that that policy is being understood by the DM of that particular district, or by the uh, uh, health department or the police department, navigating those systems, getting a call from our delivery boy that he has been uh, the police officer wants some clarification from this. On that front, fighting that battle on a day-to-day basis on 700 district was a huge challenge. So we formed a task force internally, and then just make sure that the every policy from the center is being interpreted, and whatever the local issues are, I mean, they, of course, they had a good intent to contain the infection at that point, and that how do we address those issues to make sure that medicines are being supplied to the end user, right? So this were uh, stabilized, and our teams were getting infected in the warehouse. How do we make sure that they follow those protocols at that point, make sure they have the facility, dedicated facility, we isolate them early, help them manage their disease. So that's fighting battle on all the fronts. So we, as I said, that we were warriors as well as victims. Both we were playing the role of on the both sides. So that's the balance is what we, I think, uh, had to be maintained. So, and we take a lot of pride that we delivered millions of orders and continuing doing that, 2x, 5x of our capacity, taking a lot of staff, contractually uh, upskilling them. So the entire value chain within the ecosystem and within the 1MG stepped up to the next level to handle this pandemic crisis. So that's on the e-pharmacy space. And third, on the diagnostic space, uh, RT-PCR, antigen testing, they have been evolving uh, rapidly, the policies around that. So at 1MG, we were kind of the primary objective is what value we can add into the ecosystem. That's the driving force. That's a broader guiding force, that how we can, what value we can create. So if that means that maybe helping some, doing some research work on what are the right kind of set of diagnostic tools required for the country, and submitting that to the government from a industry point of view, and from a policy level view, that this is what, as a stakeholder, as an expert in diagnostic space, this is what we think, bringing a consensus within the industry, within the expert groups. That's what we did, a lot of work on that front also, to bring that consensus. And then uh, we were part of that larger group. We were one of the grantees of Action COVID team, where we got a grant to do a free sample collection in many geographies, including Delhi, Pune, Gurgaon, and so on and so forth, where we had a network of phlebotomists, trained network phlebotomists, which we kind of working with the government, within the government hospitals, doing the task shifting. So what we realized at that point was that ENT surgeons, medical doctors were doing the sample collection piece, because there was some period where they were engaged within the government facilities to do this task that they were required in the IPD. So our role was to help them do the task shifting. how can this task be taken care of by a technician, and then higher level resource can be deployed in a particular IPD setup or an ICU setup. So that's where we did that for biggest COVID hospitals in Delhi, LNJP, GB Pant, Rajiv Gandhi, Pune administration, Gurgaon administration. We had mobile sample collection vans, and this was not for profit initiative supported by Action COVID team. Entire work was to work with the administration to get more sample collection done and to get more testing done. So that's on the Action COVID team piece. And plus on the testing piece, we started upscaling our labs to a point that now we have our own 1 mg molecular labs in multiple cities. And that was again transition from a technology platform to a physical lab and then to a molecular lab is also internally, we have to internalize, we have to upskill, we have to go to that mindset that how do we operate that on a scale. So that's on the molecular side. Now we have those labs in place, right?
So, Dr.
Dr.
Varun,
Puram.
tell us how do you manage this, right, at 1 mg? Because all these are skills and they take time. Usually, a journey for a company to evolve to this scale takes so many years, and here we did not have time. There were a lot of other constraints as well in terms of the fear of COVID, people not being available. How are you able to build that mindset to evolve so fast and keep a pace with each of the coming COVID challenge?
I think Dr. Purav, that was, I think, the passion of the team that was involved. I would say that um, uh, very, very strong, passionate team members who were taking those, empowering them to take those decisions, right? So that's no bottleneck in terms of taking those decisions. Absolutely core values is that be the CEO of what you are doing. That's the core value. The be the CEO of what you are. You do not need multiple level approvals. You take the decisions. We are there with you on that front. That's, I think, and that is one of the core values, I think. And of course, it was not as easy as said, but there were a set of challenges, and still there are a set of challenges we are kind of addressing on a daily, day-to-day basis. But I would say that set of passionate individuals on ground committed to the cause was the differentiating factor.
So tell us how has this initiative or battle changed, right, from then to now? It was a very different time. Most of us were afraid, sitting locked down in our homes. Few individuals like your team were fighting the battle on everyone's behalf. Now it's changed significantly. I think the fear has reduced, but the mortality and morbidity is way higher. It's all hands on deck approach. So the nature of the fight against COVID has changed significantly in last 15 months. And now, now that now today, how have your efforts changed? What is more important as compared to other things when we look at today's scenario?
Uh, so it is in that sense the capacity of doing each of these things. We were able to kind of we have built up those capacities in place, right? So if in 2020 we were doing X, at this point our capacity to do those was 5x already, but the demand is 10x. So, but moving from 5x to 10x was a challenge, but at least we were able to kind of address the 5x demand. That's what I would say, that capacity building was there, because basic tenets of information now would be around that. What is this second wave all around? What are the things you need to keep in mind? So information is an important parameter. So for example, doing the, if we talk about video recording, right? So we were in kind of that phase that our cameraman or the camera team would go to a place, record that video, do that editing. Moving that to digitally was kind of challenge, but in this particular phase, this is kind of prepared in that
We have
sense.
a
So
baseline,
that's
and now
we have
it's a
a
matter of
baseline in that.
scaling it up.
Yes, but of course, this phase is very, very infective. This variant is infective and very, very infective, and mortality is high. So partnering, and this phase is also about vaccination. So the difference from the last phase, if I have to say, a significant difference where we want to make a difference and significantly affect is additional vaccination piece drive. How do we make sure that n number of people get vaccinated comfortably without hassle-free vaccination, without getting because vaccination sites at some point can become a hotspot. So how do we make sure that there is a hassle-free process, pre-vaccination, post-vaccination support, whatever that is required uh, around the myths. So that's the additional piece.
I'm guessing, Doctor, and also the fact that I've been using a user of 1mg application for many years now, and the fact that you had a digital platform did play a role in terms of your ability to serve, right? How did that help? And within your digital platform itself, did you have to evolve during the course of this pandemic?
Uh, uh, Dr. Pura, so as you rightly said that there is a front end to it where we have almost 140, 150 million unique users coming to our platform every year. So to maintain that scale, to have that infrastructure in place, that's one piece. Now, what helps us is that if you look at a problem in general, our DNA is that how do we look at the problem, break it into smaller pieces, and use technology to optimize it. And use that's at least that particular skill set going down the line to every team member is very I think critical in that sense. So that brings a lot of agility in place, and our technology cycles are also weekly cycles, twice weekly cycles. So those being an agile organization, that helps to build those new processes using technology and optimizing those things. So
I think it's amazing. Like I would like to say that you guys are no longer a startup. Right? You have grown so much over the years, and still you continue to maintain that agility, that decentralized decision making around how you said each person can act as a CEO, will drive accountability. So I think it's amazing how those core principles also play a role in terms of being able to respond to a pandemic or any other opportunity or challenge that you come across. Dr. Varun, I think we learned a lot about what you have been doing at 1mg. Uh, Obviously, you guys have learned a lot during this course, being on the forefront of this fight. Uh, for our listeners, all of them are also trying to do something on with regards to the pandemic, right? Employers are trying to do something for their employees. People as responsible citizens want to take initiative and contribute back to the society. One of the big challenge that remains is what to do. Each person has a certain set of capability, their own set of limitations. What can they contribute to? So, would love to get your views on that, given you have been on the forefront of this fight, looked at it from multiple lenses. What can employers do for their employees?
very, very, I think, important and pertinent question, Dr. Purav. As I said, that we are a lot of our team members are warriors as well as we are the victims because we are exposed. We have to kind of take care of ourselves, our employees, families, community. So one of the minds, I would say that strategic shift in the mind space was that people come first. That was important. When as a leadership team is we formed a COVID task force within our 1mg group, and I think a lot of organization formed that, and that's one of the important things. At least is our learning is that we freed our calendars and said that everything rest can move on, but if we get a call from these two leaders, will focus on people, employers at the first point. Their calendar should be free that anybody can reach out. They should apply their entire problem solving skills to solve problems for their employees because the system is very, very difficult to navigate the system at times, right? Getting a hospital bed that because there are supply constraints, there is a information gap. How do we help our employees and families to navigate that system also is very, very helpful. So that's first shift was that two leaders in our organization, they took a concrete decision that they will free up their calendar. For them, people come first. That's number one. 24/7, that's the time they would spend. Then we started setting up the processes for that. What are the, how do we set up a teleconsultation piece? So we have this common email ID that's called as CTF. There we utilized our the model we utilize for the call center or the technology thing, there is a system in place for all the queries which come in from different locations where we operate. They can come to a common centralized location. Then there are level of resources who would look at those queries. And there are set of doctors which are always available, and we would have different layers of doctors. So for example, there we have a GP, we have an internal medicine specialist, we have a critical care specialist, and then we have uh, counselors to help people go through this difficult phase, right? So depending on, so there's a triaging that is done by one of the team members. They would triage those queries and see that what kind of requirement is there for the employees, starting from the teleconsultation piece. Then second, of course, uh, and we lot of volunteers from our organization, they started specializing in general for, let's say, uh, medicine supplies, remdesivirs of the world and tocilizumabs of the world. Is not easy to navigate that system, right? So a couple of volunteers would just focus on medicine supplies, make sure that how the policy is changing around it and what is the most efficient way to source remdesivir for a hospital. What is the right way to approach it? Because at times you do not know how to navigate this system. Who is the nodal officer? Who is the next level of escalation? What kind of request needs to be given to a distributor of remdesivir? All those templates were ready, right? So if a person is kind of approaching for remdesivir, those templates and information and notification would be shared so that he can quickly gather all those information, right source of information, and at least the effort is in the right direction. We do not know about the result, right? So nobody knows that that person will be able to get remdesivir or not, but at least the most efficient path we can guide that person, that is templatized form, right? So, and that is true for the work stream. Like this is medicine supplies, oxygen concentrators, oxygen cylinders, hospitals, uh, plasma, all those work streams. We created work streams and we kind of had volunteers for each of these work streams. Tried to, we had a daily hurdle on this, that what is the new knowledge level that has emerged in this particular space, new notifications, and what is the regional lens to this? How, let's say, uh, Delhi government is operating, what is the requirement in Delhi government versus a BBMB or a Bangalore? There would be a different kind of requirement, and versus Kolkata, there would be a different set of requirements. So getting those documents in place in a single resource and then putting our persistence, as they say, is very, very key in this kind of a phase. Commitment and persistence to get to help to that person. And I've seen when there are enough examples where I do remember, and I would want to talk about that. We had a employee whose father had an oxygen saturation of 70% at that point. Night 12 o'clock, the alert was generated that this is the oxygen saturation. I do remember our two employees going on a bike or a scooty, taking we had those pool of oxygen concentrator that was available at some point, took an oxygen concentrator. They had no pulse oximeter, took that pulse oximeter, went to that place, stabilized that person. Uh, in the meantime, our coordination team was speaking to multiple hospitals, seeing that where those documents can be shared so that can be facilitated. Those information real time was shared with these guys. Booked an ambulance, there was no ambulance at that point. Took a taxi, took that person to the hospital, and incidentally at the hospital they refused, that we are not clear whether it is COVID, non-COVID, all those kind of set of administrative questions which come in uh, as an hurdle, where we started pitching in as a doctor, started having those conversations to get that person admitted in that hospital. At least those emergency medications can be done. But what I was kind of pointing out was that then those things like hospital needs at some point advance payment to get the person admitted, RT-PCR report to get the admitted. So all those process level things, if a person is clear that this is expected, one, you are better prepared to handle those things, that these are the four things an hospital is going to ask. So you should be better prepared to address those questions in a way, or whatever those learnings may be. Share that, templatize that in some format so that they can be replicated at different geographies. So that's what I would.
Makes sense, makes a lot of sense. And I think for those who have had family members admitted to hospitals or had severe COVID cases, I think they can absolutely relate. It's very overwhelming for one individual or one family to get all the information in place. So this is where, if all this work is pre-done at an organization level, and if some of your friends step in, makes a huge difference. So makes sense. I think advice well taken for anyone who runs a large or a small organization. They can volunteer some time and be prepared for such eventualities. Dr. Varun, also a lot of organizations want to contribute to the larger society. Some of them are doing it in the form of funds, some of them are donating ventilators, but there is a information asymmetry. Many of us don't know where can we contribute. So, in your opinion, what are the best places to contribute, or what would be the right way to decide where to contribute?
Oh, yeah, it's a very difficult question because there is no straightforward answer to this. But let me share my thoughts on this. That how do I would want to contribute, or let's say how do I process this information? Uh, so, for example, Delhi. Let's say example of Delhi, rural India, Bangalore. They are all at the different stages of their uh, kind of COVID wave, right? So. I'll take a specific example to talk about this. So at this point, providing an oxygen concentrator or keeping an oxygen cylinder as a donation in Delhi may not that be that important, right? But the same things which happened in Delhi, all those learnings are clearly going to be important for rural India at this point. Uh, that's they are going through that phase, right? And there are very set learnings which are clear. Those so, for example, I was talking to somebody in Punjab at one of the towns. So they do not have the private facilities are not COVID facilities at all. Now that's the place to contribute that whichever city location is kind of going to reach the peak, and there are already learnings from the peak cities which have gone face those peak. If they can be translated into a smaller towns, so at this point as we speak. Uh, there's a lot of we know that rural villages are going under a lot of stress, right? And the next they do not have that kind of infrastructure or learning. So if that is the key area where, if you ask me, I would want to focus and build those sustainable models. I know of a lot of villages where there's no RT-PCR facilities, or some of them are providing RT-PCR that takes 3 days, 2 days, 5 days for RT-PCR to reports to come. Can we build sustainable models on those in those villages? Can we contribute mobile testing labs which can move from one village to another village depending on what is the requirement? So I think from a testing front, that's what one of the things I would say. Building those physical infrastructure, we know that once a city or a town or a village is under stress, it will just rapidly require a lot of resources. How do we build those temporary resources in place? As simple as that, a particular town or a city, I am not sure that if everybody is aligned on the policy level, that uh, whether this are COVID bad, non-COVID bad, so that those information.
Dr. Varun, you went on mute. Can you listen? Yes, thank you.
Yes, Dr. Puram.
No, please continue. It just went on mute for a second, so I thought I'll.
Yeah. So transfer of information from larger cities to the smaller towns is the requirement at this stage. And so, for example, Bangalore is under stress at this point. Hyderabad is under stress. So we may have to identify that which city is under stress at which particular resource. If I have to contribute, and I say that, let's say, I'm just taking an example. Hyderabad, there is a, let's say the requirement is at ICU level or ventilator level. That's the stress. Then contributing oxygen concentrator is helpful, but if we can contribute uh, at some level which is the most resource in demand at that point. But
Got it.
Dr. Puram, as I said, it's a very difficult question. It's a but simple answer for me at this point. If I look at this problem, I have to contribute. I would say that next few weeks going to be especially toughest for our villages and towns. They are
I
going to be
see.
tough,
So, Dr.
toughest for
Varun, I
them.
think one point you mentioned that kind of really resonated with me is also we're a very huge nation, and it's hard to have enough resources for entire nation all the time. But if we can build mobility within these resources, so that from one city to another or one city to a village, if we can mobilize these resources as the wave goes from one place to other, maybe at least we can provide interim relief to each location as and when they need it. So again, it's a very good thought for others for trying to contribute. So Dr. Varun, it's been very informative, all the journey you shared, the kind of inputs you provided around what all we can do as individuals, as organizations on COVID front. The second wave in some cities is on decline, but still there are fears that a lot of villages could be impacted. uh, we might face a third wave as well. It's all unknown. So, any parting thoughts on precautions, things that we should continue to do or do in the coming months?
So I think Dr. Purav, the biggest thing I would say that one, there's a lot of fatigue. Individually, all of us are under tremendous pressure. It's a lot of fatigue, families, overwhelming for all of us. So one, for all of us is important to keep that mental stability in place and go back as a leader and say that is a war time and we have to contribute. So that's what I think one of the important, because I remember one day it was uh, there was a day when I was kind of very low, very overwhelming for last 7 days. I spoke to somebody who was kind of at the forefront. After speaking to him, he said that, look, I take that pressure, go back to the fight, speak to my family, come back, speak to my friends, look at the movie or whatever my favorite thing would be. Looking at a day uh, at a single day as a single day, living in the current moment is what I do, right? So, and I have 5,000 employees when I need they need me at this point. So I go back with my shoulders high every day. I mean, that was kind of at least an energy booster for me at that point. I was low, I got an energy booster. So each one of us has to be an energy booster to we will, as an individuals, as an organizations, would have our own high and low, right? How do we support each other so that we can go back and fight this pandemic? That's, I think, number one, I would say. Or to your point, what we have learned on a clinical side or a precaution side is two, three things which we have learned. I think very critical. I take 5 seconds on this. One is masking is very important. Double masking has emerged as a very strong tool. Wearing a cloth mask over a surgical mask as a normal measure has emerged as a very strong tool. Second, we clearly know that COVID-19 is a biphasic disease. First phase is a viral replication stage, first 5 to 6 days. 6 to 10 days is a very critical time, and we have to be, as families and individuals, very pragmatic about taking those decisions and following the doctor's instructions very uh, judiciously. If a doctor has suggested a hospitalization, no intellectual entertainment around whether it is required, not required, searching on Google. If a doctor has said hospitalization, just go for it. If a doctor has said steroids, just go for it. No intellectual entertainment is required. Be pragmatic, have trust, and just move forward on that. Because if you lose time on intellectualizing all those things, trying to understand that is required, not required, what are the pros, cons, because we at times we tend to be analytical at a point. So there's no need to be analytical. Trust on your doctor and move forward on that, because that 6 to 8 days, 9 days is very critical time. And so steroids have emerged as an important medicine, and that's what I would say, that's what the important. So double mask, understanding that this is a biphasic disease, there is an important role of steroids, but steroids have to be appropriately used in an appropriate dose under the supervision of the doctor, because it's a double-edged sword, so very important, but cautiously used. And third piece, I would say vaccination. Again, no, there isn't enough data to support that the benefit outweighs the risk. So I get a lot of these queries: Covaxin versus Covishield. Covaxin versus Covishield. People want to read about a lot of data. I would say that one, we do not have the access to the entire data, and second, we do not is very. I do not know whether we are qualified enough to understand that data, compare that apple to apple, and then come out with a conclusion, right? So it's better to trust on your doctors and expert bodies to say that, look, they are saying this, we should believe, and we should move forward, because they are doing in the interest of the in the interest of the country, and they have access to the right kind of data with them, right? So, and they're qualified to analyze that data. So that's what I would say. These are the uh, my closing remarks in general. These are the 4-5 points which I generally mentioned.
Makes sense, Dr. Varun. Very insightful, and love the parting message. Keep it simple, follow all precautions, and let's continue to do everything we can to stay safe, right? I think that is the best contribution we can make to this fight, by staying safe ourselves and overall reducing the burden on the system. So thanks so much, Dr. Varun. Thank you again for taking the time. Really appreciate all the insights that you shared with us. Uh, Thank you.